Hi, today someone asked about accommodation, and what they wanted to know was accommodation insufficiency and accommodative paralysis. And before we talk about that, don't forget to subscribe if you're not a subscriber already, and put your comments in below. And remember, we only do neuro-op topics here. So if you're going to make a comment, make it clean, but make it concise and clear, but also pertinent to neuro-ophthalmology. So an accommodative insufficiency, as you know, when we're trying to determine the focal length of a lens, it's 1 over the dioptric power in meters. And so when you're looking at something at near, you have to actually generate accommodative power to get the focal length to align with the power of this whole eye. And so if we're going to look at something at 33 1/3 centimeters, that means you need 3 dioptric powers of power plus lens to generate the focal distance for that image. So when we're reading something at 33 1/3 centimeters, my eye has to generate +3 power of accommodative effort to do that. And that is done with the lens, and the normal lens. And so there's zonules here. So when this ciliary muscle fires, it tenses up these zonules, and then that will change the shape of the lens. And so when the lens gets fatter, the power increases. So we can relax or contract the ciliary muscle to relax or contract the zonules that will fatten or thin up the lens that will increase the power. This process is called accommodation, and it's part of the natural lens system. And so when you have an insufficiency of accommodation, the muscle is weak. And the most common cause of it to be weak is you're old. And the word for elder is presby, and C is opia. So we see, the old people see with reading glasses because they have accommodated insufficiency, because open, close over years and years and years, the lens gets stiffer and stiffer and get a cataract, and people like me need to have bifocals and progressives because I'm over age 50. Accommodative paralysis means you have no accommodation. And eventually that is going to occur, but most people, including the presbyopes, are just accommodative insufficiency. However, we can completely paralyze it by giving a cycloplegic agent. So if you give a drug that paralyzes the ciliary body completely, this we call the cycloplegic. So when we give atropine or some medicine like that, you're completely paralyzing it. And so that would show up to you as accommodative paralysis, but a blown pupil because it's blocked with the pharmacologic blockade of atropine. So both accommodative insufficiency and accommodative paralysis produce difficulty with near vision because you can't generate the accommodative power to generate the F from the dioptric power of changing your lens. And the most common cause is presbyopia. However, it can be meds like drugs, and it can be iatrogenic from topical agents. It's rare that it's neurogenic, and you don't have to image this or anything. It's presbyopia in old people until proven otherwise.